Hi everyone, my name is Melanie Grant, and this is C&M Glass. Today we're talking about ICD-10-CM coding for diagnoses in the coding chapter 4, Endocrine, Nutritional, and Metabolical Diseases, codes E00 through E89. Some of our key points we'll be looking at are endocrine diagnoses with a brief anatomy review, a little bit of discussion on thyroid and parathyroid conditions, hormonal insufficiencies, diabetes mellitus, where we'll take a little bit deeper look at manifestations and complications and how to code those. And then we'll close it off by looking at vitamin deficiencies and where to find the codes for long-term drug use. So before we get started, just a brief reference, we'll be looking at our ICD-10-CM 2019 edition for the expert edition from AAPC, as we're referencing page numbers and materials that are in this book. If you have a different version of the 2019 code book, that's perfectly fine. Just be aware that your page numbers may be slightly different from mine. I'm also referencing the Let's Code It textbook that's published by McGraw-Hill, 2019 edition, in reference to some of the chapter information. So let's get started. The first thing I want you to think about is, what is endocrine? Well, it's a combination of glands and hormones primarily that are produced by those glands, but also produced by other body areas or organs within the body areas of the system. You can find different parts of the endocrine system in almost every single part of the body. That's pretty cool to me, but that means there's quite a few different areas that you're going to be looking at. So I have here my very humbly drawn artwork here that is a replica of page 219 in the textbook, where we can start by looking at exactly what's included in the endocrine system. And in fact, if you turn to 219 in your textbook, you'll see a much better drawing of this. And if you look in your coding book, for chapter 4, which starts in my book on page 515, you also have a very lovely drawing which includes all the different endocrine glands and what's included in the metabolic and nutritional diseases, and some definitions that are really great to help you with this chapter. One thing I can say about the coding books is they like to give us a lot of really good reference tools and information. In this particular edition that I have, some editions may not have this, but this one has an entire 2 or 3 pages, I believe, that talks about 2 pages, page and a half, and it talks about all the different glands, the parts of the brain where the hormones come from. They break down the different anatomy of each part that's included in this coding chapter. And they tell us specifically what we're looking at, if it's part of a different organ system, and it even has a few of the common pathologies or diseases that you'll find within the endocrine system. So I highly recommend to take a few minutes to look at that. If you want to pause the video, feel free to, and make sure you come back. So as I'm looking at this, I want to point out a few of the different parts of the human body that we're looking at that produce hormones and various other parts of the endocrine system. So the hypothalamus is listed, even though it's not an endocrine gland, it's listed because it has a couple of hormones that it does. And if you remember from your anatomy classes, the hypothalamus is kind of the control center of the brain. It sends different hormones to your endocrine glands to tell your body what it needs, what it's missing, what to produce, what to get rid of. And so when there's diseases or disorders in the hypothalamus, that's this one up here, you'll notice that it's going to come to the endocrine gland because that's where it's affected. Likewise, you have 2 glands in your brain. You have the pineal gland, located further in the back, that produces melatonin, and the pituitary gland, which works along with the hypothalamus, and there's a lot of different hormones that they produce between the two. Your pituitary gland has a lot more than the hypothalamus, but they work together. So I'm not going to do a full anatomy lesson, but just know that those are some really important ones, and pay attention to what those hormones are, because a lot of times your documentation will identify a hormone, and it's up to you to make sure that you're coding the correct gland or other organ part. As we move down a little bit, we have 2 glands found in the neck, your thymus, that's lower, your thyroid and your parathyroid. So both of these work together. The parathyroid is actually very, very small, and there's 4 of them found on the backside of the thyroid gland itself. They live there. And so they kind of live in those four corners of the little butterfly shape that's right here in the throat. And then your thyroid is in the front. These produce a lot of glands together that help with metabolism. Patients that lose weight or gain weight very easily or unexpectedly may have issues with their thyroid. And so we'll talk a little bit about that. As we move down, your thymus does produce a couple of hormones, as well as your heart, which produces the arterial natriuretic peptide. Let's say that 3 times fast. Most people don't think about these, so be aware that you will find certain things if you're talking about the glands or the hormones. This is where you're coming. If you're talking about disorders of the heart or disorders of the brain or various other organ systems, they will be found in those organ systems. So one thing I can say as you're going through this week is pay attention. Let's get a different marker there. Pay attention to sections. Where are you supposed to be coding? What are you looking at? Are you finding yourself in the cardiovascular system when you're supposed to be coding for cardiovascular hormone that's produced by the heart? Make sure that you're familiar with that and pay attention also to notes and annotations, excludes, and especially your code alsos or first. Let's see if I can write that. I started writing first as I was writing also. These are some really important things that you want to keep in mind as you're going through this week, because it's going to affect your accuracy. It's going to affect your claims getting processed and paid properly. It's going to affect you as a coder, your passing rates. It really goes into a lot of these. So make sure you take all of the information you've learned about medical coding and apply it, especially with this chapter, as you're reading up and down. Make sure to start with your categories and look at all the information before selecting a code. Okay, moving down, we have a couple more that we were pointing out. We have your stomach here. Your gastrointestinal tract has a couple of hormones that is produced and secreted. Most importantly, what most people think of when they think of the endocrine system is the pancreas here. Let me just kind of draw that a little bit better. Okay, so your pancreas is in charge of your insulin and your glucagon, and is the main, it is the cause of diabetes when it applies to patients, and we'll talk about blood sugar issues. The kidney is going to be found behind both of these, and the adrenal gland found on top of the kidneys is going to be producing some hormones for you. This is really important, especially in patients with that fight, flight, or fright status, because it does give you the adrenaline that we all experience. And then last but not least, you have your male and female variations. For the female, it's the ovaries, and for the male, it is his testicles. Okay, so that all being said, pay attention to what are you looking at? What are you coding for? As we look at some of these that are found in other organ systems as well, it's especially important to make sure that you're coding for the endocrine system for your consideration, and that you're in that chapter in the E00s for your codes. All right, so let's go ahead and look at some of the different types of thyroid conditions. We're going to code some of these together today, and as I go through, I'm just going to go through the chapter and look at some of the examples with you. So the thyroid gland itself, as I mentioned, is in charge of a lot of conditions for patients with their metabolism, as well as, like, say, calcium. When you're talking about the parathyroid, they work together. There's a few different regular hormones that we check on labs, and these are routine labs that are done each year. Whenever we're checking for something that we don't suspect, we're checking it for a screening. But if it comes back and there's a lab result with interpretation that says this is what the patient has, we have to make sure our doctor has interpreted that. So that number one is always code from your documentation. Again, with the letters backwards, sorry. So be wary of coding from just the lab report, because that's not appropriate if the doctor doesn't sign off on it and say, yes, this is what this is. Now, when we have a lab report that does not have an interpretation and it's flagged as abnormal, we can code for an abnormal result, but we cannot say what that result is. So we want to be very careful about how we do that to make sure the doctor is saying this is what the patient has when we're looking at coding. On the same note, you may have doctors that will sit there and say, well, this patient had this condition last time we saw them, but until I get lab results, I don't know to say with certainty. This is an education point because what coding says is that if the patient comes in with a previous condition that was established and they're coming in for that condition, we can continue coding that even if it is considered resolved during this visit. Because at the time of their visit, they were considered as having that condition, and until we get something that says otherwise, we treat it as they still have it. But keep in mind, we have to have that documented. So be aware of that, talk to your providers, make sure they're comfortable with how coding requires us to capture that. Okay, we have a couple of examples. So before we get started, and we're looking at thyroid first, let's all look at our coding book at page 515. I'm sorry, not 515, 517, which is just after the beginning of the chapter 4 for endocrine and nutritional coding. The first two pages, as I mentioned, have all of your definitions. You have some common pathologies, or other words, common diseases, diagnoses that we see in the human body. And so they mention some here. You have adrenal insufficiency, which remember is your kidneys. You have Cushing's syndrome, which is a condition of the pituitary gland. Gigantism, or acromegaly, which is also of the pituitary gland. Hypothyroidism, hyperthyroidism, hypopituitarism, and polycystic ovary symptoms. Pay attention to the difference there between hypo and hyper. It means a completely different thing, and you'll see this term a lot as you're reading, or the suffix, I should say. The endocrine system does have several blocks. We have disorders of thyroid, diabetes mellitus, other disorders of glucose regulation and pancreatic secretion, disorders of other endocrine glands, intraoperative complications of the endocrine system, meaning that complications that were caused by an operation, malnutritions, other nutritional deficiencies, those are things like your vitamin deficiencies, overweight, obesity, and other hyperalienation, okay, metabolic disorders, and last but not least, post-procedural endocrine and metabolic complications. So you can see it's a relatively short amount of blocks, but you can see exactly where it's at. You will notice it is a relatively short chapter. It's only about yay thick. I'm not sure you can even see that. So when you're looking through these, pay close attention. Make sure to look at your blocks. Make sure to look at your chapter. You'll notice that at the very beginning of this chapter, above the blocks, there is a notes, which indicates to us that all neoplasms, functionally active or not, are classified to the neoplasm chapter, which is coding chapter 2, and something we will learn later on in another video. Meaning that if you're coding a neoplasm or a cancerous tumor or benign tumor of any of the glands or parts of the endocrine system, don't do it here. There's also an excludes one note, which indicates to us transitory endocrine and metabolic disorders are specified to the newborn and should be coded as newborn codes. So if the newborn gets something from mom, it's typically a temporary condition, and it will be under the P codes for newborns, not here. So keeping that in mind, we move on and we start looking at our disorders of the thyroid. This goes on for this block for a couple of pages. You have some really great, or for one page, I'm sorry, you have some really great notes. There's a lot of use additional comments throughout the chapter, but there is no block notes or exclusions. So we can look at that. Some of the examples we have pseudo-hypoparathyroidism, and so you want to break down that term and say, what is this? What does this condition affect? We can tell by breaking it down, pseudo-hypoparathyroidism, so it's a disease of the parathyroid, and it's something that's low. You'll want to make sure you're familiar with your terms. We have primary hyperparathyroidism. Let's see, congenital hypothyroidism without a goiter, sick E00-E89 syndrome. You have congenital hypothyroidisms without a goiter. We mentioned that. Hypothyroidisms due to medicines and other substances, and it has code first from our poisoning chapter. You'll remember that from our T categories. Use additional for adverse effects. So if you had a condition like hypothyroidism due to a drug, you would have the hypothyroidism as secondary. Your primary would be your T code for the drug or substance itself, and you would have a third for adverse effects if they apply. Post-infectious hypothyroidism, again, you're looking at conditions from infections. Thyrotoxicosis with diffuse goiters, and you have a couple of different examples there. And so it breaks down these. So let's talk a little bit about what those are. Let's go ahead and we'll code together thyrotoxicosis with diffuse goiter without thyrotoxic crisis or storm. So as the thyroid gets worse, it has a couple of definitions you'll want to be familiar with, talking about goiters, talking about thyrotoxic crisis or thyroid storm is another term for that, is when it becomes extremely elevated and is at a serious condition. Okay, so if that was my condition, I would start in my alphabetical with thyrotoxicosis. And if anybody's singing the alphabet here, that's perfectly fine. I do the same thing. Okay. I'm going to find page 332 of the alphabetical index. In the middle of the column, the middle column, a little bit down, thyrotoxicosis is listed. It has in abbreviations in parentheses the example of recurrent. So when you see an example like that, this is just a suggested term. It doesn't mean that it will apply or needs to have that word. You want to remember that. And it gives me code E00-E89, but it also gives me a breakdown as I'm reading it. I have with, and I have several items that it can be with, such as goiter, diffuse, with thyroid storm, adenomatous uninodular, with thyroid storm, multinodular with thyroid storm, and it continues. Then I also have infiltrative and due to, factitia and heart, neonatal, and transient. So I can go through those and I can say, okay, well, I know it's with, they mentioned with a diffuse goiter, and it did not have storm. So I'm going to read thyrotoxicosis with goiter diffuse, E00-E89, with thyroid storm. Well, I don't have with. So I want to look at all of those. With the goiter includes all of the nodulars, but it doesn't say without. So we want to remember that if it doesn't say without, you want to go back to the original with goiter, not mentioning thyroid storm. Most likely my code is E00-5.00. But to verify that, I'm going to go into my endocrine system in my E section, and I'm going to go first to the beginning of the chapter, which I've already done, so I'm familiar with it. I know that there's a note about neoplasms and a note about prenatals that doesn't apply to this patient, and so I can go straight to the category code, which is just that first 3 characters, E05. Now here, this is for thyrotoxicosis or hyperthyroidism, so it gives me another definition in parentheses. And it has an exclusion. It says excludes 1 for chronic thyroiditis with transient thyrotoxicosis, and it has an exclusion for neonatal thyrotoxicosis. I verify my documentation. It's neither of those. I move on. So this is why it's important to always look at that category. Now, E05.00, thyrotoxicosis with diffuse goiter, is for the E05.0. After that, it talks about different nodules, and I know it's none of those. And I should go through all the way to 9 to verify that I don't have something further identified. Now here, E05.0 is accurate, and I look at the difference broken down from there. It says there's a 5th character, so I have that little 5th in the little bubble. I'm going to read further, and it says E05.00 without thyrotoxic crisis or storm versus .01 is with. So even though I didn't find it under the alphabetical as without, I made the presumption that this is most likely my code. I came to the tabular to verify, and I found, in fact, the exact terminology I needed. It won't always be exact, so you want to remember, if it's not documented, it doesn't apply. If there's a difference between with and without, and it's not documented that it's with, it's always going to be without. Okay, so we have here a scenario, case study. I'm going to look on page 203, which is for Emily Benko, a 2-month-old female who's having dyspnea and her cries sounded hoarse. In addition to Dr. Jenkins noticed her skin color was jaundice. Her mother, Danielle, stated she is a good baby and sleeps all the time. That's lovely. I love that. Sleeping babies are great. Well, maybe. After running a TSH, that's your thyroid stimulating hormone, be familiar with that, and performing a thyroid scan, Dr. Jenkins diagnosed Emily with infantile cretinism, also known as congenital hypothyroidism. Dr. Jenkins also noted a mild cognitive impairment, which is associated with the cretinism. He explained to Emily's mother that the mental impairment is likely to be progressive. So thoughts go out to Emily's mother, because that is not a easy thing. We want to find out now, what is it that we are looking for? What is our action word? What is our main word? And so here, we could go under cretinism, which is one word they gave us, because that is the actual term that was given. But they also gave us another, also known as. So if I was to have a documentation that just said cretinism, and I didn't remember what is that, I would want to look it up and determine what is this condition, what is it also known as, what does it go under. And in here, I would then see hypothyroidism, congenital hypothyroidism. And verify your hypo, always double check. As opposed to hyper, okay? So that's my diagnosis that the patient has. Am I going to pick up any of the symptoms? Well, I have dyspnea and a hoarse sounding cry, jaundiced skin, and sleeping all the time. And in fact, none of those would be picked up because they're all symptoms of congenital hypothyroidism. How would you know that? Make sure to look at your Merck manual. Pull up the diagnoses, pull up the conditions, look at common symptoms. See what is involved in this condition if you're not familiar with it. Okay, so I'm going to start with the term hypothyroidism, because this is the action word. This is the word that identifies the actual problem. Okay, so your main term is always your problem. Congenital describes hypothyroidism. Cretinism is another word I might look up, but if I'm given something more basic, such as saying it's also known as, I'm going to start there first instead of going for specific terminology. Okay? But keeping that in the back of our mind, we can start with either of them. I'm going to find hypothyroidism on page 204, and the middle of the column about halfway down. Hypothyroidism, latent, pre-adult, recurrent, with goiter, without, due to's. So I don't see anything that says congenital. And so that's going to be one thing that's going to tell me, oh wait, this does say pre-adult. Well, she's definitely pre-adult, but I'm not seeing anything that mentions hypothyroidism congenital. So I'm now going to go back and I'm going to say, well, I can look up the term congenital first, or I can look up cretinism. And I'll give you my trick for doing this. I just go in alphabetical order, or whichever one I've come to first. So as I'm going back, it'll actually be congenital that I'll find first, alphabetically because I was ahead of that. And congenital just takes me to see also condition with a couple of options that would not apply. Okay, so next one I'm going to look up is cretinism. Okay, so I'm going to find cretinism on page 111 under cretin at the bottom of the first row. I have cretinism, congenital, endemic, non-goitrous, sporadic, all of those being in parentheses. And it gives me to code E00-E89. I want to remember that it was hypothyroidism, so I'm looking to see if it breaks down any further. And I see hypothyroid, E00-1. And so I'm going to start with the E00s, okay? But I'm going to keep in mind, I want to read up and down because I don't like this one. Our book tells us it's a different code. So when I get there, here's the thing about when you're pulling up coding. We're going to start with E00, but when we get there, we want to verify, is this the right code for me? Is there a different code that might be better? Okay, so I'm going to look at the category for E00, and I see congenital iodine deficiency syndromes, which falls under the block of E00 through E07, which is disorders of the thyroid. Now, I don't see in here, and what I'd like to see is hypothyroidism, and I don't see that. So I look at E00.1, which is recommended from the alphabetical, and it's talking about iodine deficiency syndromes. So I'm going to keep looking. If I keep looking down further, because I can read through all of these, and I would say, honestly, none of these really match my term. So I'm going to look at hypothyroidism by itself, which is found under the E03, other hypothyroidisms. I would want to make sure to look at the thyroidisms that I have, but if I look down from here, I'll notice that this excludes, well, it excludes the previous thyroidisms we were looking at, but it also has congenital hypothyroidism listed as its very first one, E03.0 and E03.1 for congenital hypothyroidisms with and without goiters. So by reading up and down, this is going to help you to identify, even if you can't find the exact term in the alphabetical, why it didn't give us that exact term, I can't always tell you. They like to send us on goose chases sometimes, or maybe it's the way we're thinking. Maybe it's what we're looking at. What I always say, though, and one of my favorite instructors used to tell me, I was learning Excel, and she would say, Excel is like trying to go to a vacation place. Let's say you want a vacation in Roswell. And I grew up in Roswell, and I used to think, gosh, why would you want a vacation there? But she always used to talk about it. She says, you can take a bus to get to Roswell. It'll probably take you about, 8 hours. You could drive there yourself, and you'll get there in about 3.5, 4 hours, depending if you're following the speed limit. You could walk there, and man, that's going to take you a very long time to get to Roswell. You could take a helicopter if you had access, and you could probably get there faster than any of these other routes. The important thing is that you get to Roswell. And that's the same thing in our coding here. The important thing is you get to your code, not exactly on how we get there. So I'm going to go ahead and pause the video. When we come back, we're going to look at some of our more detailed information on diabetes, vitamin deficiencies. We talked about a little briefly, but we'll do a couple of codes together and long-term drug use. So make sure you check into the second half of this video. We'll talk to you soon.